complete package. The fact that we can very easily reposition the patient, that allows staff to keep the patient up further in the bed, which is reducing the pressure on the pressure points for the patient. And then with the surface of the mattress and the bottom sheet, we're providing a microclimate for the patients, which is helping with the moisture issues as well.
You're less likely to have hospital-acquired pneumonias and have a silent aspiration occur.
Any of our patients that are quads or that are paraplegic or have really bad decubitus ulcers, they really benefit from it, or even our overweight patients also benefit from the Hercules bed.
To me, it's a win-win deal. It's saving us money, the staff like it better, and the patients like it better, so there's really nothing wrong, and clinically we're seeing better outcomes.
The staff just say great things about it. They just love it, from the ease of being able to move the patients, how they feel it's comfortable for the patients, easy on their backs. They don't have to wait around for people to come in and help move patients up the bed. They just think it's wonderful.
If staff is just walking down the hall and sees the patient too far down in the bed, whereas before I would have to go round up help to bring this patient back up into the proper position in the bed, I can just walk in and walk out of the room in just a matter of seconds, and that patient's now appropriately positioned.
Decreases the possibility of having injuries from pulling a patient up in bed, and it also decreases injuries on the patient, decreases the risk of shearing.
We're a small 34-bed facility, and we spend about $100,000 a year on rental beds, and for us that's about $10 a patient day. So if we're going to get a replacement, we need to see a decrease in our rental expense. Otherwise, why are we going to replace our rental beds? The first 6 months of the year before we really implemented the Hercules full-time, we were running right around $10 a patient day, and since we've had the Hercules in number, we're down to about $3 a patient day, so really almost a 75% reduction in rental expense in the last 5 months. That's huge for a small facility like us. So we're going from around 100,000 down into the 30,000 range for next year. So for us, that's basically the payoff in the beds is less than a year per surface.
It's very simple to use, but obviously the outcomes speak for themselves.
It works just like they said it would.
I'd say the Hercules has exceeded my expectations as far as getting the biggest bang for the buck and keeping everybody happy.